Hi everyone, my name is Vidhatri. Welcome to my talk on understanding substance use and misuse related to incarceration history in a New Orleans student clinic population. I'd like to thank all of you guys for joining me and listening to my talk, as well as I'd like to thank, my co-authors as well as Tulane for supporting this project. So to just set the scene, individuals who have a history of incarceration face several healthcare disparities and inequities. They're the only population in the United States who have the guaranteed constitutional right to healthcare. However, justice-impacted people face a higher burden of chronic mental, physical, and communicable conditions in comparison to their non-justice impacted counterparts. For every year that one is incarcerated, their life expectancy is decreased by 2 years. They're also at a 12 times increased risk of overall mortality and a 120 times increased risk of overdose mortality within the first 2 weeks upon release. So overall, there's many factors that kind of play into this, but incarceration exacerbates the social determinants of health that already the most vulnerable members of our society often experience, both while being incarcerated as well as prior to being incarcerated. And so regarding substance use and misuse in incarcerated populations, 65% of people who are currently incarcerated are affected by an active substance use disorder. As well as 85% of people who are incarcerated meet the criteria for substance use disorder. Additionally, prevalence of cigarette smoking is twice as high in incarcerated populations when compared to their non-justice impacted counterparts. And so you might be thinking, why is this important? Well, this is really important because, the United States has the highest rate of incarceration in comparison to any other country in the world. And then on top of that, Louisiana specifically has the highest incarceration rate out of all 50 states. And I know this is SMA and you're thinking, okay, fine, it's relevant to Louisiana, but how is this relevant to just the southern region of the United States? Well, it definitely is, because many of the states in the southern region are one of the states on that list of states with high rates of incarceration, excuse me. And so what our study sought to do was basically threefold. The first being that we wanted to understand how many formerly incarcerated individuals the Tulane student-run clinics serve. The second was to evaluate the prevalence of substance use and misuse among formerly incarcerated individuals that we serve, as well as their non-formerly incarcerated counterparts. And then we wanted to take whatever our findings were and then utilize that to provide information necessary for student-run clinics to best serve their formerly incarcerated patients. So what we did is there was data that was already collected for all of our patients using REDCap surveys from February 19th, 2017 to July 9th, 2023. And there is a question that they'd already been asking regarding whether you had a history of incarceration. So we looked at those individuals who did answer that question and then subdivided that into two groups, one that reported a history of incarceration and one that did not report a history of incarceration. And so these questions were already asked among all of our patients, and we specifically looked at the questions regarding a history of smoking, interest in smoking cessation, smoking within the past 30 days, alcohol use, alcohol misuse within the past 30 days, and illicit drug use within the past 30 days. So we used chi-square tests to do our analysis. And what we found is that 47.6% of patients answer the history regarding, whether you have a history regarding incarceration. And of those who answered that question, 71% of patients indicated that they did have a history of incarceration. So overall, regardless of whether individuals answer that question or not, around 34% of people self-reported that they did have a history of incarceration in our total patients served throughout our time period of 2035. And we found that both groups were predominantly male and Black, with the average age being in the early 40s. And so looking at the analyses that we did, we found that the group with an incarceration history had a significantly higher self-reported history of smoking, history of alcohol use, history of smoking in the past 30 days, and history of illicit drug use in the past 30 days. But what we found to be particularly interesting was that the group with a history of incarceration actually had a significantly lower self-reported history of alcohol misuse in the past 30 days, and they had a significantly higher interest in smoking cessation in comparison to the group that did not have an incarceration history. And so we know, and then what was even more interesting about this was that this was in line with literature that has already been published regarding individuals with a history of incarceration being more likely to engage in initiatives that address substance use disorder post-release in comparison to the general population. And so we know that there's high rates of incarceration in Orleans Parish. We know that there's higher rates of substance use disorder in formerly incarcerated people, and we know that there's higher rates of mortality post-release from substance-related conditions. And so, looking at the findings of our study, we found that a large number of patients that are receiving care by our student-run clinics are formerly incarcerated. And, we were able to highlight some of these differences regarding substance use. And so we really want to take this information that we were able to gauge and use it and leverage it to recommend that community members and providers at student-run clinics should be familiar with these statistics so that they can incorporate targeted screening to better meet patient needs. And, this isn't, we did this study at Tulane, but I think that this study could definitely be replicated at other student-run clinics across the nation. And honestly, I suspect that their findings will also be in line with us, as several student-run clinics end up caring for the most vulnerable populations of our society. And we should leverage this unique relationship that we have, an opportunity to engage with individuals who are formerly incarcerated so that we can address some of the gaps that they've faced in the healthcare that's been provided. So as a medical community, we can come together to support and uplift individuals who are incarcerated or have a history of incarceration regarding their healthcare journeys. So thank you guys so much for joining my presentation today. And if you have any questions, please let me know.
Well, thank you. This was really interesting for me to listen to. We do have a couple of questions in the chat. So I will start with what level of training are the providers in the Tulane student-run clinics? What interventions does your group suggest?
For sure. So actually, that's one of the limitations of our studies, is that the providers in the Tulane student-run clinics, so essentially what that looks like is we have first years through fourth years who are at different levels in their training, who are asking these questions, right? So they might answer these questions based off of what the patients have said in different manners. And then we also have residents who are engaged in the student-run clinics as well as attendings, but oftentimes our medical students will conduct these surveys and do the patient intake. And so that can cause there to be some confounding variables regarding how they answer those questions on behalf of our patients. And the specific interventions that our group suggests is, doing more training for student-run clinics on substance use and misuse, and then also making them aware of the resources we have in our community, whether it be at the med school or within just New Orleans in general. And so something really unique that we have here in New Orleans, and there's many different organizations that do similar things across the country, is we have the formerly incarcerated transitions clinic that specifically helps individuals upon release to navigate that healthcare system and connects them with healthcare, as well as transportation, other aspects of social determinants of health. So, if students or members of the Tulane community who are working in these Tulane student-run clinics are unaware of how to best meet the needs of their incarcerated patients, they can definitely reach out to the FIT clinic. I hope that answered your question.
Yes. One quick thing, because I think you touched on this during your presentation of just, sharing the information and making sure that your clinicians are aware of the targets and just what is happening. But one of the other questions was, what follow-up over what time period will be done to assure that these results are not just short-acting, short-term?
For sure. So is that specifically regarding the interventions that we've suggested?
Unfortunately, that is just what the question says.
Okay.
So, and I,
Okay.
like I said, I think you kind of touched on that just by
Yeah.
during so, but if there's anything you wanted to add to that, and if
Yeah, so we're actually working up on follow-up studies to actually implement trainings and do kind of a QI project. And so we hope to kind of flesh that out further in our follow-up projects to make sure that this isn't just something that, because I'm here in med school, that, okay, this happens for, until I graduate and, we address this, but then once I leave, it's not going to be discussed, right? So we're currently working with members of the medical school to come up with ways to ensure that this work is done and it's longitudinal and it's sustainable. But the formerly incarcerated transitions clinic that I spoke about, I actually work with them, and it is led by an attending who is also part of the School of Medicine, and they have a joint partnership. So regardless of how long I stay here or not, that Fit Clinic will be around and that partnership with Tulane will continue.